So good afternoon, everyone. It's great to see you all. My name is Stacy Stewart. I'm President and CEO of the March of Dimes, and we are back for this next installment of our Healthy Mom, Strong Babies during the COVID-19 pandemic series. We're really, really pleased to have you all and so excited to have this conversation that I know is on the minds of so many people. Today, what we're going to be talking about is managing stress and anxiety during pregnancy, and we're going to talk about it postpartum as well. And I'm really excited about the conversation and also really thankful that this event is supported by funding from Sage Therapeutics. And we want to thank Sage for their support and allowing us to bring this great content to so many of you all. So one of the things that we know about pregnancy, and we've had one of these sessions before, but it was in such popular demand, people asked us to come back to talk more about how do I manage stress, anxiety, depression, even during pregnancy, while I'm expecting a baby, and even after the baby comes. Look, we know pregnancy is already, can be an anxious time for women during normal times. And what we know is that we're not in normal times right now. These are extraordinary times. And for that reason, we see a lot of women talking about the fact, thousands of women talking about the fact that they're experiencing unusual symptoms of anxiety, depression. Many women who anticipated if they're pregnant today, maybe thought that their pregnancy was just they had it all planned out. They saw it perfectly in their minds about how it would all work out. And now this pandemic and stay-at-home orders and isolation at home, quarantine at home has changed so much for everybody. In addition to that, it's really meant that a lot of new and expectant mothers are undergoing significant stress. This pandemic has really affected women in ways that none of us could have imagined. And a lot of women are not only concerned for their own health, but they're concerned for the health of their babies as well. And that's understandable. The other thing is that we've been hearing a lot of this on the news and the media from experts that this is such a novel virus. We're learning so much about it every single day. And we're seeing and learning so much about the impact that it's having on everyone's mental health. It certainly is having an impact on everyone's mental health, I would say, but especially it's having an impact on women and on moms. And that's exactly what we want to talk about today is what are some of the signs and symptoms that a woman may be experiencing some issues around anxiety and depression, and what can women do about it, and most importantly, especially in ways that won't further harm her or her baby and will keep her as safe as possible. Pregnancy and birth does not stop because of a pandemic. Women are pregnant and they will continue to stay pregnant until they give birth. Women who maybe weren't anticipating becoming pregnant may get pregnant during this time. And it's one of the things in life that doesn't stop because there's a pandemic. And so one of the things we've got to do is figure out how do we adjust ourselves to the current conditions and how do we respond to the way the world has changed, given that we're in this new period of time, the way hospitals have altered their policies of maybe keeping supporters and family members and a husband or a partner or a spouse from even being in labor delivery with us when we're ready to give birth. Changes to doctors' office hours and the way doctors even conduct prenatal visits, and how is that being done, and how do I adjust if I'm pregnant today with that new reality? There may be limited appointment options or new telehealth options that maybe I wasn't thinking about having to utilize before, but now that may be the only option that I have. And what if that's not even an option because I don't live in a place where I have access to broadband? I mean, these are some things that are really contributing to women's anxiety and their fear and their depression. These are things we want to help women work through. So these shifts that have been made in our health sector are really understandable. I mean, obviously we have healthcare providers who are doing everything possible to keep us all safe and as safe as possible. But we do also know that doctors and mental health professionals are telling us that they are preparing for an increase in pandemic-related mental health challenges. We're already starting to see it. We're already starting to hear it. That the stress, the isolation, and even the economic distress that so many families are going through is really contributing to a worsening outlook for mental health. Where a lot of folks are expecting that we could see a secondary wave in cases of coronavirus in the fall. So this isn't even something that we can even put a time frame around because it just appears to be ongoing and we won't really know when it ends. We know it will end at some point, but we won't know exactly when. And because of a lot of that uncertainty, there are folks like the Kaiser Family Foundation that are reporting that 45% of adults are saying that the pandemic is harming their mental health. 45%. 19% of adults are saying it's having a major impact, with rates slightly higher among women, or among Hispanic adults, and among African American adults. Again, these feelings of uncertainty and loneliness are just amplified during this period of time. And one of the biggest concerns we all have is the fact that we know that stress and anxiety can have a tremendous impact on the health of everyone's health, especially can have an impact on the health of pregnant women and new moms, can affect things like creating high blood pressure, and even creating situations in which a pregnancy could be adversely impacted with increased stress. We know that at least 15% of women in the United States experience postpartum depression. So we're going to talk about that even if depression, anxiety doesn't show up during pregnancy, it does in fact show up for a lot of women after they give birth. And what can we do about that, especially again, while women are trying to keep their babies safe through breastfeeding, baby wellness visits, and all of those things. So that hopefully gives a little bit of context. We certainly want people to understand that it is normal to have some worry if you're pregnant. I think all women worry and think about the future with their babies. What we want to do though today is to help you manage your fear and anxiety during an especially difficult time, and want to recognize that it is a hard time for everybody, a very challenging time, and that it is even normal to feel even heightened feelings of fear and anxiety. But again, we have experts that are here to help you. We have resources that are here to help you. Let me just remind you, you're watching us on Facebook, please, please, please use the chat box. Don't forget to put in your questions, because as we go through this conversation with our experts, who I'll introduce in just a second, we'll be able to answer your questions. So please use the chat box freely. Please also check it, because we also will make sure that we're putting resources, links to different resources in the comment section on Facebook. So at any point in time you have a question, don't hesitate to put it in. We'll be sure to take all the questions that we can during this time together. So again, thanks for joining. And to support the conversation, I'm going to introduce our panelists. First, I want to start with Dr. Maria Music. And Dr. Music is Associate Professor of Psychiatry, Obstetrics, and Gynecology at University of Michigan, my alma mater. Having nothing to do with why she's here. It's just quite a great, fortunate coincidence. She's also the director of Zero to Thrive and the Women and Infants Mental Health Program. She's the medical director of the University of Michigan's Perinatal Psychiatry Clinic, and of MC3 Perinatal, which is a statewide teleconsultation for providers who are serving pregnant and postpartum women. So she is certainly an expert in this area. And Dr. Music, so great to have you. Next is Jennifer Pental. She's an ACE certified personal trainer, health coach, fitness nutrition specialist, pre and postnatal fitness specialist. She is the owner of Simply Fit, as you see behind her shoulder there, and a nutrition and training company, and that is Simply Fit. She's also author for Posh 7 magazine. Jennifer, thanks for joining. And then Dr. Joanne Patterson. She's a doctor prepared nurse, a psychiatric mental health nurse practitioner. She is the national director of Zeta Phi Beta Sorority's Stork's Nest Prenatal Education and Birth Equity Program. She's also a private practitioner in Atlanta, Georgia. Zeta Phi Beta, I just will say, has been one of our strongest supporters at the March of Dimes for almost 50 years. They've been highly engaged with us on all kinds of activities, from March for Babies to even Stork's Nest, which is a historic partnership to make sure prenatal education and resources are available, especially to low-income women. So Dr. Patterson, thank you for joining as well.
Thank you for having me.
Absolutely. So let me just start with Dr. Music. I want to just get into some of these issues right now. And Dr. Music, you're an expert in women's health, women's mental health, especially, and the director of this nationally known perinatal psychiatry clinic. What are some of the things that you're seeing with respect to women's health for moms and babies? And what are you seeing that you can shed some light on in terms of what we're learning right now?
So first of all, Stacy, thank you for having me. Thank you for March of Dimes to put on this Facebook Live event, and for Sage just supporting this. As a perinatal psychiatrist and therapist in this arena, I've worked in this in this area of supporting moms and families during this pregnancy and postpartum time period for the last 20 years. And I can tell you that, yes, anxiety is a normative reaction. In general, anxiety is something we're hardwired to have, and it cues us to important, potentially dangerous aspects of life, and helps us to actually counteract them and overcome dangerous situations or moments. And so in some way, a little bit of anxiety is maybe helpful. And we see on average in the perinatal period, so in pregnancy and postpartum, approximately 30% of women might have some anxious thoughts, fears, anticipatory fears of the labor, something new, or maybe a prior experience that was difficult, painful. So anticipating some difficulty. We see up to 10% of clinical range anxiety. With the current situation of the events around COVID, the novelty, unpredictability of the situation, we see a heightening of these numbers. And anxiety is, I would say, raging. It's we have 25, 30, up to 50% of women showing really anxiety that is in a level that would meet clinical criteria. What does this mean? It means that it interferes with your daily functioning. It interferes with your ability to function either during pregnancy and kind of get through the day, sleep, eat, take care of yourself, or postpartum to be caring for your baby and function.
Well, and one of the things that, we were just talking about is so much has changed. I mean, it's enough just to prepare for pregnancy and giving birth. And now the world has so changed in just a short period of time. So what are you advising women, especially as it relates to maintaining, their mental health? What are you advising women to do right now in order to adjust these changes, to stay on top of things as they move through their pregnancy and beyond? I mean, how are you advising them to sort of take care of themselves during this time, especially with their mental health?
Well, that's a good point. I think at first and foremost, just knowing that anxiety and then subsequently depression over time, when you're anxious and unrelentingly anxious, which affects your mind, body, and behavior. So it's not just your thinking has changed, but also your you might have physical symptoms of heart racing and shaking and digestive problems, sleep problems. So over time, it might wear you down and you might become depressed. So first, just acknowledging that a range of emotions right now is normative, and that's not, you are not crazy, you are not over the top, you just acknowledging and taking kind of some inventory of your own feeling and saying, yeah, I feel all these things. I'm anxious, I'm frustrated, I'm irritable. And you know what? Yes, that's what I am. And I can acknowledge it. And now I can reach out to get help for it. And that help, I would say, number one is connect with others. Talk about it. Talk about with your partner, with your family, with your friends, with your community, your religious community, your neighborhood community, those who are trustworthy, loving people around you who can help you with just talking. We know that just talking and addressing feelings is already helpful. At the same time, we have some other strategies that are helping with decreasing your own stress system, because anxiety, this is all driven by our innate body systems that are helping us through danger. And that's the sympathetic nervous system that's activated. That's why we're so agitated. It's the cortisol production that goes haywire. In order to calm that down, to calm the brain regions down that are cueing us to danger, which again, this is the amygdala. That's a special like fear detector, danger detector in the brain. To calm that down, we have some strategies. We have actually a calming center. It's called the parasympathetic nervous system, the vagal nerve. Every activity that calms the vagus can naturally calm you. What are these activities? Deep breathing, meditation, mindfulness, connection with others, compassion, self-compassion, movement. So we can talk about all of these. I can tell you a little bit more about each of them, but we know these are evidence-based natural strategies to calm your own kind of brake system or calming system in your body. I think
actually just listening to you talking about it is making me feel better right now. So, and we do want to come back to some of helping us understand more about how we do that, and if we need help on it, where do we go for help? But I want to actually, Jennifer, I was going to come to you, but if you don't mind, I'm going to go to Dr. Patterson and I'll come back to you because I want to pick up on some of the symptoms, Dr. Patterson, that Dr. Music talked about, which, you know, it's interesting with mental health. I think people think, well, I'm just supposed to feel bad, or I'm supposed to have maybe negative thoughts or something. But you know, I think Dr. Music touched on that. There could be a range of symptoms that may be attributed to mental health, but don't really show up like some of the typical things that we'd expect. So what are some other symptoms of maybe a declining mental health state, and what should women be looking out for?
Well, you're right. There are, you know, the in-your-face symptoms that, you know, we would see, the classic clinical, but then there are others where, you know, it's more subtle. So changes in appetite, poor quality of sleep, um, problems concentrating. I see a lot of that. You know, a lot of women aren't able to focus. They just keep saying that their minds, this is what they say, my mind just keeps going at night. And that's that intrusive thoughts and just obsessing over things that are happening throughout the day, or, you know, job security is an issue at this point. So those are the types of things that you'll see. Poor quality of sleep is another one. um, you know, we're already a very high-tech society, and, you know, if you're one to listen to the news, watch the news, that just sort of expands the panic button. You know, you hit that panic button and it's just, you know, you're up, and there's that cartoon with, you know, the character with their eyes wide open. That's the sort of feelings that a lot of women are experiencing at this point. Um, what's the other one? Fear, feelings of fear and worry throughout the pregnancy. That's another one. You know, what's going to happen to my baby? What will happen during labor? What will happen when we bring him home? Are we going to still have our house? You know, are we still going to have enough money to buy food, diapers, bottles? You know, it's all of those things that keep women up at night, especially if they're pregnant. Then there's others that are more severe. Um, so those thoughts or intentions of something happening to the baby,
Yes.
that's another one. So if patients are coming in saying that I fear that something is going to happen to my baby, what if he's or she's not breathing at night? I go check on the baby every 5 minutes or every 20 minutes at night because I'm scared that, you know, he or she is not going to be breathing in the morning. Um, and then there's more severe ones where it's actual thoughts or intentions of harming the baby.
Right.
That's where we're into a different scope as it relates to mental health.
So if a woman is experiencing any range of these symptoms,
Sure.
I mean, where does she go for help? Especially think about women who today may have lost their job. We have, what, 40 million people unemployed. Maybe they've lost their health benefits. If they even had them to begin with, if their benefits even cover mental health, it's not clear. So are there networks, are there resources, are there places, are there support systems that women can go to, you know, to really seek help if they start to experience any of these symptoms?
Symptoms in terms of mental health and where they seek support, sure. So there are warm lines that's the I don't want to say the least invasive or the least helpful, but that's where you start with the warm line, where there are supportive people at the on the other end, where they can guide you into different places or resources in your state or your city or your town.
You called it a warm line?
Warm line. So
Okay.
there's a warm line. Postpartum Support International has a warm line,
Okay.
and that warm line is for women who are experiencing these symptoms. They're not clinical. Some of them are clinical, some of them are not. They're just wanting, they're passionate about this, and they want to help guide women through the process. So there are warm lines where they can go to just sort of say, listen, I am experiencing these things and I just don't know what to do. So then they are then directed to those resources.
Are
Crisis.
those lines typically 24/7? And
Yes.
okay.
Yes, they are. So it's a 1-800 number, and they can call that, and they are directed to someone in their state. Then there are crisis text lines. So for those who don't like to talk, they're texting. So there's crisis text lines where you can text. It's 24 hours a day, 7 days a week, where women can seek help that way as well. And then also too, looking at your local health department, they have low cost options for seeking mental health providers. So I would always direct women to do that as well.
And I think a lot of these, I'm sure like our team is putting a lot of these resources in the links to make sure people know where to turn. Sure. That's great, Dr. Patterson. I'm gonna come back to you. And Jennifer, I wanna turn to you because we touched on earlier that nutrition, fitness, exercise are all a part of our overall wellness that both help our mental health, and our mental health obviously is connected with our physical health. So talk about, if you could, just how you're talking to women who are pregnant or just had a baby about the importance of nutrition, what should women be thinking about, and how should they be thinking about exercise as well?
Yeah, absolutely. First of all, yes, thank you for having me on today. I'm grateful for this opportunity to share knowledge with all of the pregnant women and new moms out there. And I hope there are also some people watching that support these women to kind of gain some knowledge and some tools like we've had shared so far today. So nutrition and exercise, yeah, all of us are dealing with a lot of these feelings of worry, fear, uncertainty is huge right now, and things are kind of out of our control. And when you're pregnant, sometimes even under normal circumstances, you deal with a lot of those feelings. Your body is changing so fast, especially if it's your first baby. You don't know how life will be different. You don't know how the pregnancy will progress and all of these things. So having tools, right, a toolbox to deal with that for pregnant women that also applies to everybody else. I kind of have an acronym that I find is helpful, and it's MEDS, MEDSS. And while pharmaceutical medications have a big place, that's not what I'm talking about here. What I'm talking about is more lifestyle practices that women can take on, everybody can take on every day. So the first one being M, movement. Okay, so movement absolutely improves your mood. Whatever kind of movement that is, just getting up, getting out of bed, getting off the couch, going for a walk. If you can be outside in the fresh air, even better. But yoga, Pilates, those types of, especially if you can find a prenatal yoga class, even Zumba, right? Turn on some music and dance. Everybody feels a lot better when they're up and moving, especially in the comfort of your own
virtual classes too, right? So that virtual class is really the way to go, I think, right now.
Right, because nobody can see you. You can turn off your camera and just groove, right?
Yeah, you can be in your messy bun and no one will know, right?
Nobody knows. Be in your bedroom slippers, it's okay. So yeah, movement is huge. And the second one, one more thing about movement real quick. So a lot of women when they're pregnant are concerned, well, is that safe for me? What kind of exercise is safe? Can I exercise? Absolutely, and you should exercise, okay? But a few precautions. One, if you're going to be outside, if you're going to be walking outside, do it, especially now in certain parts of the world that we're coming into summer and the days are getting hotter. Avoid the hotter parts of the day. Go earlier in the morning, go later in the evening, go on a shady trail, something like that that's a little bit cooler. And then avoiding any type of
please wear a mask too. Sorry to interrupt you. Please wear a mask when you go out.
Right. Mm-hmm. And distance yourself. Try to choose times of day, either earlier in the morning when there's less people out. don't go to the highly concentrated popular areas. I know where I live, there's a lake and there's a lot of people, and I totally avoid that area because there's no way the dog and I can get past everybody. So the other thing is avoid types of exercise, especially if you're doing classes online, you know, kickboxing or that kind of thing. That's not really a good idea because of potential impact or twisting to the abdomen. So yoga, Pilates, especially if you can find a prenatal video or class online, and walking are all good, safe options for everybody. The second thing, ME, is eating and what you eat. And I'm not talking about eating for two. I'm talking about eating the right foods to help you stay healthy, but also to help reduce some of those feelings of stress and anxiety. A good general plan that I always recommend is an anti-inflammatory eating plan. And what that is, real simple, is eat a rainbow, eat a bright variety of colorful fruits and vegetables, whole grains, nuts, seeds, lean meats, you know, healthy fats, that kind of stuff, but really avoiding sugar and processed foods, because studies have shown, and if, you know, many of us have experienced it ourselves, that what we eat absolutely has an impact on our mental health. So eating too much sugar can cause mood swings and cause aggravated feelings of anxiety and things like that. So avoiding sugar and avoiding processed foods. And again, during pregnancy, processed foods, especially deli meats and processed meats, can be dangerous. They have a lot of chemicals and potentially bacteria that could be harmful. So just sticking to the fresher fruits and vegetables and lean meats would be the way to go with the eating. And the next one is drinking. D, lots of water, 8 to 10 glasses a day of water, or you know, herbal tea, sparkling seltzer water if it doesn't give you heartburn, you know, and then avoiding alcohol, avoiding energy drinks or caffeinated drinks, and really avoiding artificial sweeteners as well, because those are also unsafe. So then sleep, the last two are S's, sleep and stress relief. Okay, so ensuring that you're getting enough sleep, at least 8 hours a night. And if you're able to nap, that counts. Take advantage of that time, especially while you're pregnant, before the baby arrives. Really enjoy your sleep. We need it. If you have trouble falling asleep, I think we've talked about some of the things that we can do to help reduce that, cutting down on negative news or social media posts that kind of get you agitated. Don't watch that at night. I would avoid screen time. You really want to avoid screen time at least an hour before bed. If you want to connect with your family and friends, just do it over the phone. Read a book, take a bath, those kind of things. And then avoiding, obviously, if you're drinking caffeine, you don't want to drink any caffeine later in the day. And then stress relief. So meditate. We talked about meditation, movement, yoga, picking up a hobby, something that makes you happy and helps you kind of relieve stress would be a great idea. So movement, exercise, movement, eating, drinking, sleep, and stress relief would be the 5 things I would really recommend.
That's awesome. That's great. And those are very helpful. And I think, you know, we just sometimes don't make the connection between nutrition and our mental health. And so I think that's all very helpful. Dr. Music, I want to go back to, you know, you helped us. We were almost going into a meditative state when you were talking, because you were helping us calm our amygdala, which was really great. So go into a little bit more depth on that. What are some, you know, so the woman's at home, she's maybe doesn't have access to all the resources in the world, or may not be able to seek out a psychiatrist or a therapist. What are some of the things at home she can do to sort of calm herself, center herself, bring herself back to some ability to manage her mental health?
So I think that I love this acronym METS, Jennifer. I will use that because I think that you nailed it. The self-care strategies are the number one, and all of the ones listed are actually helping to decrease your own anxiety. And I'm a big believer in deep breathing. And I can tell you that women, if they learn to use that as a tool, this is a tool that you have with you all the time, taking deep breaths, just sitting down and inhaling through your nose, maybe counting to 4 so that you are taking these deep, slow breaths, then holding your breath for a couple seconds, and then exhaling through your open mouth for a couple seconds. Again, you can do this as a square breathing where you count to 4 every time. So inhale, hold, exhale, hold, and inhale again. Deep breathing is one of the most potent activator of the vagal nerve. This is our calm center that then calms down our fear center, the amygdala. If you practice this, if you do this 3 times, 5 times a day, just for a couple minutes, 3-4 minutes, over time, your set point is lower. It doesn't take away the anxiety overall, but you know, the problem is that if we have already a heightened anxiety, the threshold, anything that adds to the stress, a negative thought, an anticipatory worry, something real life, kicks you over the edge, and you might become panicky. And you were asking for some symptoms of these panicky. It's uncontrollable worry. I can't concentrate. I think I'm losing my mind. Heart racing, shortness of breath. My belly hurts. I'm trembling. So this would be one of my first strategies. The other is, and I love that Dr. Patterson brought up Postpartum Support International. PSI does not only have a warm line where you can call. In each state, there is a chapter. So there are within the chapter then regional representatives. So it might be that even in your neighborhood, one of those chapter members is running support groups. Right now, they offer statewide virtual support groups. You can just check in free of charge. Every day, there is 1 or 2 support groups where women come together virtually and talk about what's going on with them. Just letting it out and realizing, contextualizing, I am not alone. I'm not crazy. I am one of many, and we can get through this together.
Absolutely.
PSI can then help you also connect if you need more support to more formal therapeutic offerings in your region. And that's where maybe I, as a psychiatrist, psychotherapist, would come in and discuss with a woman, tell me what you have tried in the past. Have you done any formal psychotherapy? Right. That could be skills-based, that could be more movement-oriented or creative, or could be talk therapy, as well as, if needed, maybe we will help temporarily with a little bit of medicine.
Yes.
And that's also on the table. It's our last resort often that we say, you know, if all the other supports you tried, it didn't help enough, right, let's add for a little bit, for maybe a couple months during the pregnancy and postpartum, medicines that we know work, but are also safe for you.
And I think that's a really important point. And Dr. Patterson, did you want to add to that as well about medication, especially for women who are pregnant or breastfeeding?
Right, with in terms of support structures, sure. So lactation.
And just even on the medication front, like how are you addressing that potentially with pregnant women or women in postpartum?
With Dr. Music, that, you know, we start with non-pharmacological first. That's our first line, and then we gravitate towards the pharmacologic side if what she's doing, what we've put in place isn't working, so that we're addressing it from all sides. Usually both are helpful together, as opposed to just having therapy or medication management. We like to do both. And in terms of PSI, Postpartum Support International, the directory that Dr. Music was speaking of, there are professionals who are therapists, there are physicians, there's nurse practitioners, and it will also list whether you do medication management or not, so that, you know, moms have a quick way of, you know, determining what can I, you know, because no one wants to spend a lot of time looking through lists. So it's really helpful that it's they designate who are prescribers and who are not, so that if they've tried the therapy and now they're moving on to medications, then they can, you know, seek those professionals. But lactation consultants are so important. That's one of the areas in terms of postpartum where they are at risk for a perinatal mood disorder and anxiety disorder when breastfeeding does not go well. So making sure that you have a lactation consultant in place, I would say way before, and I'm probably jumping ahead, but when you're doing your birth plan, I would go right on ahead and create a postpartum plan as well. Why? Because we think about the birth, we want the birth to go well, but then when we get home, we don't have something in place. So connecting with a lactation consultant is important. I would say before even the baby's here.
So one of the things I think is really interesting is this idea of a birth plan, I think is, and I know the March Times, we've got some resources to share with women around tools that you can use to actually prepare a birth plan. And I think your point is so important around not only having a birth plan through childbirth, but even beyond. And maybe any one of you could talk about the part of, I know how a lot of women manage their stress and anxiety is preparing and feeling prepared, feeling like if you've got questions, you know who to ask, you know what to ask. And sometimes just even, being provided more information can help calm you down because you don't feel like you're not in the know or you're confused. So how important is it right now for women to be working on that birth? And I'll throw it open to anyone, to prepare that kind of birth plan, and who should she be working with to do that? And especially if it goes all the way through pregnancy and beyond. And I'll start with Dr. Patterson or Dr. Music, whichever one. And Jennifer, if you want to chime in as well.
Sure. Dr. Music, did you want to add anything here?
I mean, I think that you and I can see we are on the same line. Maybe I just kick it off and then
Sure.
you elaborate. I think that you are just right. Birthing, pregnancy, and then laboring, and then postpartum, it's teamwork. It's teamwork between you and your partner and your family, but also your professional team. And this is your OB, this is your midwife, this is the doula that you might bring in. That this team works together. And so I really encourage the women to advocate and to think through a birth plan with their partner, with their family. Who will be there? How do I want it? What do I expect? What do I hope for? And then to discuss this already during the prenatal visits with the OB team. One big change right now is that many of the prenatal visits got changed, either changed to fewer sessions or changed to virtual visits that are less frequent or more medically based, and there is less space to talk. And so that is a challenge for women, that they are feeling, some of my questions are maybe less elaborated on. We here in Michigan have counteracted this. We did a survey with women, and that was one of the big fears, that they said, I feel a little bit left hanging if I don't see my providers so much. I really need them, both pregnant as well as postpartum. So we are creating these virtual additional support groups that are running weekly from OB. And then if needed, we also have psychiatry support groups for those who need a little bit more support. So really rallying around the woman right now and giving space to talk about it.
So it sounds very much like you're saying, if you've got questions or concerns, don't hesitate to ask your care team about anything. There's no dumb question. There's no crazy question. I mean, any question you've got, probably 1,000 other people have had it. So there's no shame in asking good questions. Dr. Patterson, go ahead.
With the postpartum plan, the question was, who do you work with on that? Family, yes, of course. And I think this is where the doula, if she's able to do the antepartum side, which is the prenatal side, and the labor side, as well as the postpartum side, then she would be a good person to work with in terms of creating this plan. Because as a first-time mom, you kind of don't know what you don't know. And so you need someone to help guide that process. So you're not thinking about, who's going to do the laundry or who's going to cook, where the meal's going to come from, who's going to watch the 2-year-old while I'm recovering. Who's in place in the event that, breastfeeding is not going well? How do I get to my appointments? That's the other thing. When my husband is at work or my significant other is at work. So the doula is a very, very important person in the entire team as it relates to care for.
So spouses and partners are really important in this. And it sounds like what you're saying, it's really important to communicate with, especially if you've been quarantined at home with someone, and hopefully they're a very supportive spouse or partner. Maybe they can help pitch in and help on some things that you need help on, and not being afraid to ask for the help is really important. But let me ask you a question. Because there are a lot of folks that have been, I mean, now that some of the stay-at-home orders are being lifted, maybe it still is a concern, but during a period of time when so many people, more people were isolating at home, I'm sure there have been many, many situations in which a woman may have been isolating at home with someone who was not the safest person to be with.
Right.
Someone that may have had mental health challenges themselves, and the woman may have felt at risk, or maybe she was at risk of some sort of intimate partner violence and things like that. For some women, that still may be continuing. So, Dr. Music, I'll turn it to you, but then others can chime in. Like, what are the particular concerns there, and what can women do if they find themselves in those situations?
Oh, thank you. Thank you for raising that, because you're right. Social support is extremely important, and that's what women need, both in pregnancy as well as postpartum. Postpartum, with all the hormonal changes and sleep deprivation, maybe even more than before the birth. However, if there is tension in the relationship, that can get aggravated, and we know that social isolation, that during this pandemic, making families stay put, actually might increase this tension. And in fact, we know 1 in 4 women is exposed to interpersonal violence in the US. And we actually do know that over the last couple of months, these rates of interpersonal violence were rising. And so women who already had some difficulties in the relationships, that these relationships might have gotten even more unsafe, and women need to kind of make sure that they are prepared. And so I am working with a lot of women who are experiencing interpersonal violence, partner violence. My first strategy to counsel them, of course, kind of assessing acute risk and safety, but it's kind of to see, is there a possibility to de-escalate in the moment, the situation, if there is no possibility to kind of split and move out or leave, but is there a possibility to de-escalate by, maybe walking away, avoiding certain topics, not using drugs and drinking together or at all in the household, because that kind of disinhibits and escalates even more. And then having a backup plan, an exit plan always, to have a packed kind of suitcase with all the essentials, your papers, the car keys, the phone number, and an address that's safe, and maybe your ID cards and everything, so that you can leave. There is also a national hotline for violence, and it's important. It's a 1-800 number as well. So kind of looking this up, this the National Domestic Violence Hotline, to order, or 911 if necessary. But I really am glad that you're raising this. This is a big risk for women at this time.
And I think we all really feel for those women that are in these very, very challenging situations. And I also know there are ways to text help. If you don't feel safe calling for help, there are certainly ways to text for help as well. Absolutely. Jennifer, I want to go back to you though, to talk a little bit about, how you're interacting with a lot of women who are pregnant and even after pregnancy. And I think one of the hardest things that people have, I know it is true for me, and I'm not pregnant and I'm not in a postpartum phase, is just finding the time. finding the time to exercise. I mean, even though we've been at home, so there are many people working from home. If you've got other children in the house that you got to take care of, or you may have someone else that you have to tend after, it's just sometimes women have a hard time finding time for themselves, finding time for exercise, making the time to be conscious around eating. So how do you talk to women about just making the time for this?
Yeah, it's about planning. Honestly, time invested in planning is insurance that it's going to happen. So especially if you have other children in the house and you have to make time around their schedule or around your family schedule, or if you're also working, finding time to fit it in then. So getting up in the morning, even 15, 20 minutes to do some yoga in the morning. But another thing that's important, and I remember this after my children were born, is having a schedule, having a reason to get up and brush your teeth and get dressed and get the baby dressed and ready in the morning, to do something. And whether that's a virtual play date or an online mommy and me yoga class, look at it doesn't even matter if it's in your area, if it's online, search for some of those resources in groups, in support groups. And once things are safe and open in your area, if you have the baby in a stroller, the stroller is going to ensure 6-foot distancing. Then if it's safe for you to go outside and meet for groups, but schedule these things so that okay, on Tuesday at this time, I'm going to go do this. Or if it's between work meetings, then schedule things during lunch. If you have an hour for lunch, and I definitely recommend for women, especially pregnant women that are still working from home, that you take breaks away from the screen, that you get up and you move around. So lunchtime absolutely is a no screen time. So get up and go to the kitchen or go to wherever, talk to people, whether there's people in your family that you can talk with, or call a friend, as you're eating your lunch, just to get some interaction, but plan that time. And then if you can get in some exercise during that time as well, little bits throughout the day do count. So if you have a hard time scheduling it in. Another thing, before bed, we talked about sleep and the importance of sleep. And sometimes how people have a hard time falling asleep. Doing some yoga before bed and ending in a nice meditation in Shavasana can help you get in the exercise as well as ease into sleep.
That's great.
Can I add one?
Yes.
I think that one of the wisdoms that I over the years acquired is, flexibility is very important.
Mm-hmm.
And I mean flexibility in terms of, yes, having a plan, having a birth plan, having a postpartum plan, having a routine, having all of this is important. So as much as you can plan ahead, but then being also flexible and open to let it go and go if it needs to be different. Because one of my most memorable patients were the ones who were, the top, managerial, and they had it all worked out in life, and they kind of figured it out, and they had a plan. And then it was so hard to let the plan go and adjust to maybe different circumstances.
Yeah.
And having that flexibility. And the second pearl that I would like to share is having self-compassion and being kind to yourself. You don't have to be perfect. You have to be just good enough. And that is in your own kind of way, how you are caring with yourself, with your partner, but also with the baby. Moms have such high standards, what they should be doing and ought to be doing. All the shoulds, just let it go. Be kind to yourself. I am doing also research on mother-baby bonding and interactions and what is good enough mothering. We have 50 years of data that honestly, there is no such thing as bad mothering, and the kids are fine.
Your kids will be fine, right? Your baby will be fine, right?
So it's really, if you sometimes are spaced out, if you sometimes didn't immediately attend to your baby, it's okay. Be just gentle to yourself.
I think that's great advice. I think that advice is really great for everyone. And, Dr. Patterson, just to go to you, because we're going to be out of time pretty soon here. I want to also just raise up some of the issues that we're seeing in communities of color as well. And, Obviously we're seeing the disproportionate impact of the coronavirus on communities of color generally. We already know that mental health disproportionately and challenges with mental health do show up in communities of color as well. I think for a lot of us, the last few weeks, just watching the news on top of a virus, seeing the kind of violence that's been going on in communities of color has just been distressing, to say the least. And what would you say to women of color today about, especially a pregnant woman, a woman who's just had a baby? What should she pay extra attention to, and what should she be doing to make sure that she's taking care of herself as well during this particularly challenging time?
I do think that, like as Dr. Music said, that what we feel is normal. The anxiety, the despair, our bodies are programmed to actually react to those things. It's important for the African American population, women, even women of color in general, to be in tune to what they are feeling physiologically and to acknowledge it and to sort of uh, direct themselves to be able to talk about it. I don't think that we're able to express how we're feeling. We're always having to be put together. And this is one more area where we're having to sort of bottle ourselves up because of the perception that women of color face, what we're perceived to be, we're angry and, all of that sort of thing. So I think that this is the time for us to really rally around each other. This is sort of a saving ourselves moment where we need to rally around each other in terms of just being able to talk about how we feel. We need safe spaces. We need safe spaces to be able to express how we're feeling, but also to being able to take care of ourselves. So I know that, for instance, with our Stork's Nest program, we are able to we're able to connect with moms in a manner where it's face to face. Right now, it's a little difficult because of COVID, but that's a safe space for them to be able to talk about the things that they're experiencing as it relates to not only just the COVID, but just daily life. As when you're in a low socioeconomic status, there are things that we're not thinking about in terms of equity, the things that we are, we take for granted. We can just sort of move through life. There are things that they're facing that we're not thinking about. So that's a safe space where, one, they get to tell us how they're feeling, and we get to learn from them about the needs that they have, so that we can then, partner with great organizations such as the March of Dimes to, help them with that. So if you don't know what the Stork's Nest program is, it's a 47-year partnership between us and Zeta Phi Beta Sorority and the March of Dimes, where we have a prenatal education program that is incentivized by shopping for baby items with our stores. And with the program, they are encouraged to seek prenatal care. They're encouraged to engage in healthy behaviors, and then they get to shop in our nests. We also provide other areas for safe spaces with our moms, with our birth equity projects that we do. So there are projects where we address transportation equity, we address nutrition equity, because those are two important pieces of our puzzle in terms of getting moms to where they need to be in terms of being healthy for their pregnancy. So
That's really great. So really looking at a lot of those social
Yep.
determinants of health. So
Yep.
all these things that contribute to our health,
Sure.
challenges with transportation and nutrition and all kinds of things that are really important. So we're just about out of time, and this has been amazing. I think you guys have been so terrific and added so much to the conversation. Before we close out today, I do want to thank you all, and want to thank all the folks that joined us today on Facebook. A couple of things I want to say. Again, I want to thank Sage Therapeutics for their generous support, allowing us to really focus this session on mental health, managing stress and anxiety. Their support has been really important for us to continue to bring this kind of information to so many women that are looking for it. And I know, again, there were a lot of probably links and resources that were added in the comments section. Just want to share a slide with additional links and resources to make sure that everyone knows where to follow up to get more information. Certainly at the March of Dimes, on our website, we have a whole range of resources and lots of information there. I want to tell you about the fact that we've been even virtualizing a lot of our programs, like our supported pregnancy program focusing on quality prenatal care is virtualized. If you are a mom and your baby ends up in the NICU, we are virtualizing some of our NICU family support programs to make sure that if you're a mom and you need additional support with your baby in the NICU, that those resources are there. So go to our site. We had another friend from the Maternal Mental Health Leadership Alliance that had joined a previous webinar. We think that organization has some great resources, and especially for women of color, the Shades of Blue Project has just done an amazing job in looking at issues of maternal mental health, especially among African-American women in this country. Mental Health America, another great resource, the National Alliance of Mental Illness. And this was mentioned a lot, Postpartum Support International, the postpartum.net website, and also the 1-800 line, I think was already posted. So when the conversation was going on, so thanks for that. And also, if any woman is dealing with substance abuse issues, there are a range of resources, and you can certainly find help at that website as well. Just want to let you know, this has been a great conversation, and in addition to having these webinars focus solely on mental health, we've actually been embedding mental health conversation in almost every one of our webinars because they continue to come up. I want to let you know lastly too that we talked about the importance of strong supportive spouses and partners. We certainly recognize that another big important day is coming up here soon in a few weeks, and that's Father's Day. We are doing a really big push to recognize the fathers at the March of Dimes with all kinds of recognition. Looking forward to that and celebrating those dads on Father's Day. We're also making a big push. So if you love this content that we're bringing at the March of Dimes, and if you want to support our efforts to do even more, we really want to encourage everyone to continue to give to the March of Dimes, and there are ways to do that here. So please feel free to fund our ongoing support and all the different programs that we're offering to moms and to babies. So I want to say thank you again to Dr. Patterson, Dr. Music, to Jennifer Pental, for being such great panelists. You guys were awesome. Thank you for lending your expertise and really making all the suggestions and all the resources that so many moms need. Thank you all for joining. Just want to let you know we will have another one of our Healthy Moms, Strong Babies during the COVID-19 pandemic series next week. Next week, we're going to be talking about knowing your options, where to give birth for women that are thinking about, should I be doing a home birth, or should I be really going to the hospital? And if I go to the hospital, what does that really look like for me? These are some of the questions that a lot of women are having right now. So if you have some of those questions, or you have friends that do, please share this on Facebook, share it generally. We post all of our webinars every week on our March of Dimes social media. My social media, you can follow me at March of Dimes CEO on Twitter and on Instagram, and follow the March of Dimes on everything, LinkedIn and Instagram and Twitter. We always give updates on our webinars, but we hope that you'll join us on June 4th for the Know Your Options, Where to Give Birth During COVID-19. So thank you all to the panelists. Great to see you all, and have a great afternoon. Take care.
Bye.
Thanks for having me.
Thank you.
Thank you.
Thank you.
Thank you. Bye-bye.
Bye.